Welcome to PodcastRx, a new monthly podcast from Diamond Pharmacy Services.
Each episode is a conversation with the men and women who make Diamond the nation's largest correctional pharmacy provider, Pennsylvania's largest independently owned long-term care pharmacy, and a trusted retail pharmacy and medical supply provider to many in Western Pennsylvania.
We chat with pharmacists, nurses, technicians, and other key personnel for a deeper look at the administrative, clinical, and logistical challenges of filling prescriptions and delivering healthcare, from our local counter to across the country.
And we also get the occasional glimpse into the professional journeys of our guests and why they chose the careers in pharmacy and healthcare.
For our debut episode, we sat down with Deborah Milito, Pharm. She is the Director of Clinical and Consultant Services for the Skilled Division of Diamond, as well as the Chief Antimicrobial Stewardship Officer for the company. She has a long career in clinical pharmacy, with experience in acute care, correctional, and long-term care settings. Away from Diamond, Deborah is the chairman of the Antibiotic Stewardship Committee of the American Society of Consultant Pharmacists, that's the ASCP for short, and was a recipient of their President's Award for Education in 2017. She was named as a Fellow of the organization in 2018. With Deborah's title and professional affiliations, you can safely assume that antimicrobial stewardship was a big part of our conversation. We also talked infection control, Impact Act compliance, and her preparation for the then upcoming ASCP National Meeting in November of 2018. And about that ASCP annual meeting, all the antimicrobial stewardship talk we had with Deborah was especially relevant because just a few weeks after we recorded the episode, Diamond was awarded the 2018 Herb Langsam Award for Excellence in Pharmacy Provider Services from the ASCP Foundation. Of course, Deborah was on hand to accept the award at the annual meeting. And the reason for that award? You guessed it, a Distinguished Antimicrobial Stewardship Program. Without further ado, here's our full conversation with Deborah Milito. I'm Adam Campbell, and this is PodcastRx. I'm here with Deborah Milito, Pharm. She is the Director of Clinical and Consultant Services for Diamond Pharmacy Services for the Skilled Nursing Division, Skilled Division. Deb, welcome to the show.
Thank you, Adam.
I'm really excited to talk to you about the different things you have going on, especially with regard to antibiotic stewardship, also your involvement in ASCP. We were getting together talking about the episode ahead of time. You had a lot of things to share, so I think it's going to be a really, really great conversation. But getting first right into your efforts with antibiotic stewardship, such a big thing and a very important thing, quite obviously. But I know that that's really been trying to think of the right word, but that's been like your primary focus. Let's call it that. Your title, you're the Director of Clinical Consultant Services, as we mentioned, but you're also the Long-Term Care Chief Antibiotic Stewardship Officer. Now, if I understand that correctly, that comes from the recent Centers for Medicare and Medicaid Services rule, the mega rule from 2016, that there had to be a stewardship officer in place at different facilities. Am I getting that right?
Well, sort of. The CMS mega rule that came to be in 2016 was in phases. Phase 1 was in 16. Phase 2, it was November 28th of 17. And Phase 3 will take place November 28th of 2019. So we actually skipped the year of 18. I think the thought was that that's when you can try to get everything started and start to monitor. But interestingly, the Phase 2, November 28th, 2017, is when you had to have an infection control and prevention program in place that would include an antibiotic stewardship program along with a robust immunization program. So one of the areas of concentration would be to have an infection preventionist on board at every facility. So that's some new terminology. That person used to be called the infection control nurse. So now they're called the infection preventionist. So I think that might be what you're referring.
Okay. Now, how did you get so involved, in particular, in these antibiotic stewardship efforts?
Well, it's a little bit of a long story, but I'll cut to the chase if I can. When I was receiving my doctorate in pharmacy, I had to do clinical rotations. And the one that I was so interested in was infectious disease. And so I had the honor, I guess I would say honor, of doing a 10-week infectious disease rotation with a PhD, MD infectious disease specialist who kept me on my toes. And I liked it so much that I ended up doing 3 rotations with him, or 30 weeks, which was very extensive. And I just never forgot about that, and it just became even more important to me as my practice has evolved, especially with the CMS mega rule. And I thought now's the time that I can really apply everything that, I have been working with, but more intently.
Yeah. Now, when we talk about application, if you could talk more about what Diamond is doing with the different facilities specifically. I know you mentioned education. Now you're tracking the goals of the original implementation. Can you tell us how you began that and where it is now, the general process, and where things are with all that?
So here at Diamond Pharmacy Services, we want to be as proactive as possible with different initiatives. And the Antibiotic Stewardship Program was one of those initiatives. Knowing that the facilities, the long-term care facilities, needed to have that in place by November 28th of 2017, we actually started in August of 2016, starting to educate our facilities about what they needed to have in place. Because quite frankly, I knew that it was going to take that long to start talking about it and to be implementing parts of the CDC core elements for a long-term care facility for an antibiotic stewardship program. And so what we did was we started with introducing everyone to the 7 CDC core elements. And then each month I would send an antibiotic stewardship note to our facilities, and then I would highlight each of the core elements. Like, for example, the first one is leadership, and I gave examples as to who should be the leaders based on CDC recommendations, and what were those roles of the leaders, such as adding antibiotic stewardship to a job description, making sure policies and procedures were in place. So that's just one example of one core element. So we have continued with the monthly antibiotic stewardship note to each of our facilities, and I know that a lot of them then utilize them at their infection prevention and control meetings.
This big emphasis on antibiotic stewardship. Now, if I understand correctly, antibiotic resistance is a very big issue. You're seeing a lot more antibiotic resistant strains of different bacteria, and there's been a lot of, from what I understand, inappropriate prescribing just across the board, not just in your particular field, skilled nursing, but just in general. So if I understand that's how all these new rules came about.
You're absolutely right, Adam. Back in 2014, President Obama signed an executive order noting that antibiotic resistance has become a national threat. And in fact, we are starting to see multi-drug resistant organisms, which is a very scary thought. But even scarier are what's called XROs, which are extensively resistant organisms that we had not seen previous. So it's not just up to the long-term care facilities. There are actually CDC core elements for hospitals and also for outpatient entities like dental offices, surgery centers, urgent express type of facilities. It's really wherever you go, we all have to be more aware of the resistance to antimicrobials. And I sometimes use that word more than antibiotics to be more inclusive with antivirals, antifungals, and medications like that we're seeing resistance as well. So not only in a healthcare setting do we have to be worried about resistance, but just all of us in the community need to understand that if we have a case of bronchitis or sinusitis, that we should not be having a knee-jerk response by calling our physician and getting an appointment and demanding an antimicrobial, because it's just not necessary. Sometimes we just need to treat the symptoms and not use an antibiotic.
Sure. What's the progress then been like? You mentioned educating about the core elements and things like that, but what's the progress been like at the facility levels? How are the staff and everyone at these facilities implementing the goals and implementing the rules and performing?
So I think we're doing pretty well with some basic processes. We've had leadership, we've had accountability, we have drug expertise, and I think that with those three core elements, we're actually doing pretty well. Now we're getting into the meat of the core elements, which now it's almost a year. In November, it will be a year that everything's been in place. And I think this is where we now have to start putting an emphasis on the tracking and the monitoring of the core elements. So, for example, perhaps we've done a very good job of making sure there's an appropriate diagnosis, or that there is a cut date or discontinuation date for each antimicrobial. But now we really have to start looking at reducing the rates of urinalysis that are ordered, cultures and sensitivities. And then we have to start reporting the rates on influenza immunizations, pneumococcal, knowing that there are two different pneumococcal vaccines. That's what we have to start doing and start doing a better job with.
Alrighty, time to take a little break from the show to talk about continuing education, specifically for those of you who work in long-term care. Working in a personal care and assisted living communities and skilled nursing facilities is a career full of rewards and, of course, many challenges. One of those primary challenges is keeping up with the issues and trends affecting the care of the residents, from the clinical to the regulatory. You're already required to earn continuing education credits, but sometimes this is an inconvenient and costly ordeal. Diamond Pharmacy Services is proud to help the hardworking long-term care professionals of Pennsylvania and Ohio through our educational conferences that we have. These educational conferences are totally free and feature continuing education courses on a variety of timely topics, kind of really affecting the long-term care profession. Presenters include Diamond's very own pharmacists, nurses, and professionals, along with occasional outside guest speakers. Attendees not only enjoy free admission and free continuing education credit, but they also get a free breakfast, lunch, and snacks throughout the day. They also have a chance to meet with specialty vendors and win door prizes. Who doesn't love free stuff? The conferences are typically scheduled in the spring in Pittsburgh, Pennsylvania, and Lancaster, Pennsylvania, and in the fall in Columbus, Ohio, and Indiana, Pennsylvania. If you're interested in learning about these Diamond educational conferences, we invite you to visit www.diamondpharmacyeducation.com. On that website, you can view current registration and agenda information, speaker biographies, and take a look at past conference photos and videos. We'd love to welcome you to a future conference. And did we mention they're free? Now, back to PodcastRx.
I noticed from some of the research I did before we sat down, I was looking at the ASCP's, summation of the rules and what it means for pharmacists, and they recommended the pharmacist is the ideal candidate to be the antibiotic stewardship officer. So, I kind of wanted to ask your thoughts on that as a consultant pharmacist, and because I can imagine there are other healthcare professionals that could work to implement these things, but what about being a consultant pharmacist in particular suits you to do this?
I think the consultant pharmacists, as most pharmacists, are the drug experts. So I think we can bring a lot to the table to educate those that are sitting at the table with us, such as the medical director, the director of nursing, the assistant director of nursing, the infection preventionist, and then we do need to have a community person there, as well as someone from the lab. I've also included the hospital pharmacist who spends a lot of time with the infectious disease physicians. That's always very helpful. And I think the more people that you can get around the table, the more progress you make on an effective antibiotic stewardship program. So at each facility, our consultants are quite capable of being the antibiotic champion or the chairman of the infection prevention and control program, but not always time to do that. So more times than not, it's the infection preventionist that acts as the chair, but we all play a very vital role in that committee.
So you're the Chief Antimicrobial Stewardship Officer of not just, you oversee facilities as part of the skilled nursing, but for all of Diamond. So what do your responsibilities entail with that title?
So anytime that there's something significant that changes in the antibiotic world, I'm sure to get that information out to all of us that, need that information, such as the Clostridium difficile guidelines. We haven't had new guidelines for something like that for quite some time, so that was very important. I also will talk about influenza vaccines and how important it is to get your vaccine. And at Diamond, we have a very good program here that you can receive your immunization while you're working pretty much. And so anything that's a timely topic, I will address either through an antibiotic stewardship note or a newsletter type of system, and anything to get the word out there.
Yeah, and that's mostly CDC is your biggest source for that information?
CDC I use quite a bit. I also use the Society of Infectious Disease Pharmacists. I also use IDSA, which is the Infectious Disease Society of America. And much like we're doing a podcast right now, I listen to a lot of antibiotic stewardship podcasts, and that's where I get a lot of information too.
Oh, very good. Good to be part of the now overall antibiotic stewardship podcast conglomeration out there, I guess, so to speak. Talking about infection prevention and control in particular, something else you had mentioned before we had our conversation, C. diff guidelines and immunizations. Can you talk about in particular what you've been doing at the facility level with these two areas?
Two of my favorite topics. So the Clostridium difficile guidelines, there were new ones that came out late 2017 into 2018. They actually didn't get published until 18, but they're called the 2017 guidelines. And there were some very significant changes with those guidelines. Most notably, metronidazole has fallen out of favor as first-line treatment. Now it's vancomycin oral or fidaxomicin. The other part of those guidelines, which I wish every guideline did this, they added antibiotic stewardship measures such as discontinuing a proton pump inhibitor, knowing that there might be some epidemiological relationship, making sure that you are looking at the offending antimicrobial that might be causing the C. diff and asking the question, can that be DC'd? Looking at bowel regimens, do they need to continue, especially those that are routine when someone is experiencing C. diff? And then they also included very good infection prevention and control measures to take while a resident was going through C. diff treatment, such as the ability to cohort one resident with another resident if they had the same organism. So if you don't have access to a private room, you could put two residents together that had Clostridium difficile or two residents that had influenza, but you can't mix the organisms in the same room. And it talks a lot about the contact precautions, how long to utilize them, and when can you actually DC the contact precautions, because we know that that doesn't need to continue, for as long as some people think. So I really liked those guidelines in that they gave very specific definitions of what kind of treatment to give for first reoccurrence, second reoccurrence, multiple occurrence, and then antibiotic stewardship initiatives as well as infection prevention and control. Your second question was about immunizations. And so part of an effective antibiotic stewardship program is a robust immunization program. And so there are three 3 immunizations that we should be discussing for our seniors. One of them being influenza, the second one being the 2 immunizations to prevent pneumococcal disease, and the third one is the vaccine to prevent herpes zoster.
You want to talk a little bit about each of those, just how prevalent they are in the populations that you oversee?
So there's a program by CDC. There's an initiative called Healthy People 2020. And what they're asking every facility to attempt is to reach certain goals by the year 2020, which, before we know it, it is going to be 2020. So we really have like the rest of 18 and then 19 to get this right. So for influenza, they want it to be a 90% immunization rate. And the days of people not receiving influenza are sort of going by the wayside, because now you have to have a declination page as part of your immunization program that says, why aren't you getting the influenza? Why aren't you receiving the pneumococcal? And so even in some facilities, it will be upon employment, they will be required to have the influenza vaccine. If they say no to it based on perhaps religious reasons, then they'll have to wear a mask during the season of the influenza and coming into so many feet of contact with a resident. So know that influenza is not a live vaccine, so you cannot catch influenza from getting the vaccine. That's a myth. And I think we all have to be proponents and champions of we should get our influenza vaccine. And in some facilities, they actually have the administrator receiving the influenza from the DON, and the DON then getting it from the ADON, and it goes on and on and on. And so as a consultant pharmacist, I'm going to be asking my consultants to get their influenza vaccine and actually show that when they go to the facility in October, that they were part of the team and they did get their influenza vaccine. Something else that we're doing for at Diamond is we're preparing an influenza preparedness binder. And we started this last year, and it was so popular. And now our facilities are saying, when are we getting that binder? And so what we've done is we've calculated the creatinine clearance of the residents that live at the facilities. And that's so that in case they have to give Tamiflu, which is an antiviral med, they will have the creatinine clearance already available because it is renally dosed. And we also include information in the binder about egg allergies, because now that's another little myth that if you don't have a serious egg allergy, you can still get the flu vaccine. And then we give you information about a checklist to make sure that you're ready for influenza season. And then we give you the Tamiflu dosing guidelines that are prophylaxis, treatment with or without renal dysfunction. So that's what we do for influenza. For pneumococcal disease, there are 2 immunizations. There's Prevnar 13 and Pneumovax 23. And we do a lot of education in our facilities explaining which one to receive first. And so for one example, if our resident is pneumococcal immunization naive, and they're greater than 65 years of age, they would receive the Prevnar 13 first, and then in 1 year they receive the Pneumovax 23. So again, it's important to receive both in most cases after the age of 65. And then the third vaccine is for herpes zoster, and there are 2 vaccines. One is called Zostavax, but the newer one is called Shingrix. And Shingrix is actually the vaccine that is recommended now to be given because it confers immunity for a longer period of time as our seniors age. It will protect them into their 80s. So that's a 2-dose injection. So you receive it at baseline, and then in 2 to 6 months, you receive the second dose. And that's really important that everyone remembers to get the second dose. And for Healthy People 2020, the goal would be 30% immunization for against herpes zoster. For pneumonia, it's 90%, and then for influenza, as I mentioned, it's 90%.
Moving away from infection prevention control and the antimicrobial antibiotic stewardship efforts, I understand that there is another CMS rule that affects the skilled nursing world, and that is the Improving Post-Acute Care Transformation Act of 2014, also known as the IMPACT Act. Now, if I have this right, Deb, this mandates the collection and reporting of standardized data in your case, skilled nursing facilities, several other settings, home health agencies, inpatient rehab, long-term care hospitals, but most importantly for our purposes, skilled nursing facilities. So what I was curious of is, how does the consultant pharmacist fit into helping the skilled nursing facilities to meet the IMPACT Act standards?
Yes, that's a very hot topic right now. That's actually going into effect October 1st, 2018 at the long-term care facilities. And it really is something that the RNACs at the facilities will have to do a very thorough job on every new admit and readmit when it comes to making sure that they know what the allergies are for the residents, making sure that the meds that they were on in the hospital are matching what they're on at the facility on admission, and they're also having to do that on discharge. So sort of as a value-added service for our Diamond Pharmacy Services consultants, we are already doing medication reconciliation for every new admit and readmit to our facilities. So we're hoping that that information will be a tool that the RNs and the RNACs will be able to utilize, and will help them to be able to document, have the proper documentation on a form called the MDS. So that's something that that's evolving into a rule that goes into effect October 1st. So we're just trying to assist.
Okay. The MDS is part of the IMPACT Act. That form is something stipulated by that? Or?
Well, the MDS has already been in existence,
okay.
But there are now different questions that have to be answered by the nurses that filled them out.
Okay. Are Beers List updates part of this, or is this a separate thing?
So the Beers List is a list by Dr. Beers a long time ago, talking about medications that would be inappropriate in our senior residents. So every 3 years now, the Beers List is updated, and there's a new one that's being proposed for 2018. I've only seen the draft of those. I've attended a webinar not too long ago, and there will be some changes for the 2018 version, but there'll be some deletions. And I think the thought process of that was that there were some medications that were on the Beers List, and it's broken down into tables, that were seen on rare occasions, so there really wasn't any reason to continue them. So I think that's you're going to see some deletions in the 2018 version, but the addition part of it is going to talk a fair amount about what we call DOACs, or direct orally acting anticoagulants, especially as how they affect bleeding or increase bleeding when combined with other medications. So a lot of drug-drug interaction information.
We're going to take a quick break from this dialogue to bring you more dialogue. In this case, Dialogue, D-I-A-L-O-G, stands for the Diamond Information and Learning Opportunities Group. It's Diamond's very own in-house speaker and continuing education bureau. And if you have a group or facility with continuing education needs, Dialogue can help set up an in-service for you. Our expert speakers and educators include pharmacists specializing in gerontology, anticoagulation therapy, and HIV, to name a few specialties. We also have a certified registered nurse practitioner and educator specializing in disease states and well-being. And we also have numerous professional staff with expertise in everything from human resources management to safety and disaster preparedness. Dialogue also offers an LPN IV certification program. It's for licensed practical nurses in the state of Pennsylvania. It's an 8-hour course, and it is approved by the Pennsylvania State Board of Nursing to satisfy the mandated regulation to allow an LPN to manage and initiate IV therapy. The class is only open to facilities, organizations, and groups of 5 or more. For more information on these courses and other continuing education opportunities, please contact Trina Plazio at 800-882-6337, extension 1100. You can also visit www.diamondpharmacyltc.com/learn/dialogue. And now back to PodcastRx. Now switching away from antibiotic stewardship efforts and CMS rules, just switching strictly to you, your professional life has been pretty busy lately, just in general as a consultant pharmacist, not just here at Diamond with the initiatives we just talked about, but also outside of that in the professional organizations that you're in, particularly the American Society of Consultant Pharmacists. I understand you have a board membership that's upcoming.
Yes, I do. I'm very honored. I was elected into that position for the American Society of Consultant Pharmacists. So I'm very anxious to see what that's all about, and I think my first meeting is October 30th.
Well, congratulations to you. How long have you been involved with ASCP?
For about 13 years. I started out as a member of the state chapter in Pennsylvania and started to receive information from the national ASCP organization. And then I got involved in the state by becoming the Western director. And so we have 5 different directors in Pennsylvania, and I held that position for about 10 years. And I was responsible for providing education on a myriad of topics, helping with our every 2-year education day that we have in the state, and really got me interested in maybe pursuing other areas of interest with ASCP. So I recently became president-elect for the state, and as you said, becoming a board member of National ASCP, but I'm also the chairman of the Antimicrobial Stewardship and Infection Prevention Committee. And I started out 3 years ago as a member of that committee, and then I became the chairman 2 years ago, and it's led into being the chairman this year, and I hear that I might stay the chairman for next year too. And under that committee, we've had so many different initiatives or charges, and one of those being the development of the antibiotic toolkit, which has been very popular throughout the country. People can order them from MedPass, and it's been great to either initiate an antibiotic stewardship program at your facility or even purchasing them at this point to help you with the tracking and monitoring process. We also developed the SIDP ASCP antibiotic certification program, which, as you said early on, that I completed that, and it's 37 hours of continuing education. The first part of it were recorded webinars. The second part were live webinars. And then the third phase was a special project that you had to do. And it just gives you such a great base of knowledge to feel more comfortable as being an antibiotic champion at your facility, or certainly playing a larger role in your infection prevention and control committee. Mm-hmm. Another charge that we had was to educate our facility staffs about immunizations, and that's why I'm going to be doing an immunization presentation at our national meeting in November, and we actually have a panel discussion that we're going to be talking about the goals of Healthy People 2020, go into each immunization that I already talked about, and then we're going to end with frequently asked questions specifically about influenza. And
it is the time of year is upon us there with influenza. So you're going to be speaking at the national meeting of the ASCP in November. Also understand that November is Antibiotic Awareness Week. So I know you've done some things here for the staff at Diamond in years past. What do you have planned for this year?
So we do like to focus on the Antibiotic Awareness Week, and CDC has a plethora of information that they send out to us, whether it be the written material or emails or items that you can copy and display on your windows at your pharmacies and whatnot. But I always give a little something to each of the consultants. Last year it was those little gummy worms, and we were trying to prevent those bugs, from getting into our facilities. And then another time I got some plush fungus-looking type of dolls, and they had a choice of giving them to whatever facility they wanted to try to prevent, different diseases popping up at their facilities. So I'm not quite sure what I'm doing this year yet, but I'm thinking about it.
I'm sure either way the gifts will be a hit. I forgot about the gummy worms last year. That was quite a nice touch. I was going to ask you, I was like, what was the significance of that again? But the bugs totally makes sense. Well, Deb, thank you so much for joining us and talking about all the different initiatives, all the different irons in the fire that you have. You're certainly a very busy person right now. So thank you so much for taking the time to be on PodcastRx.
My pleasure.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
On the next episode of PodcastRx.
For the past 15 years, Diamond has hosted the educational conferences. These events, part seminar, part trade show, allow long-term care professionals to earn free continuing education in courses taught primarily by Diamond Pharmacy employees. With our 2019 conferences underway, we thought it would be a good time to bring you a special episode recorded live at the Ohio Educational Conference in October 2018. We caught up with several of our conference presenters and some attendees to capture the conference experience from both sides, all while surrounded by the African wildlife of the Columbus Zoo. Don't miss this special edition of PodcastRx. PodcastRx is produced by Diamond Pharmacy Services, the nation's largest correctional pharmacy provider and Pennsylvania's largest independently owned long-term care pharmacy. To learn more, visit www.diamondpharmacy.com.
Music by Maximiliano Silvera, Sound Express by Getty Images.